Welcome back. So our session right now is on digital mental health. Our moderator is going to be Anna Swartz, who's an independent researcher, and she will introduce or have them introduce themselves, the other panelists. So thank you.
Can you hear me? Okay, thank you, Ellen. Good morning. As Ellen said, I'm Anna Swartz. I'm an independent researcher. My work typically focuses on neuroethics, philosophy, and mental illness. But lately, I've been sort of obsessed with digital mental health, and specifically the smart pill technology. So I'm super excited to be moderating this awesome panel and joined by such amazing people here. First, we have Dr. Tom Insel, who is a psychiatrist and neuroscientist. You're co-founder and president of Mindstrong, which is a Silicon Valley-based startup that focuses on digital health technologies, mental health technologies. And you served as former director of the NIMH, the National Institute of Mental Health, for I think 13 years, right? Yep. Okay, so next we have Dr. Mona Sobhani, who is Director of Research and Operations at the USC Center for Body Computing. And you're also a neuroscientist, and she is also a former student of Alan Sachs. And lastly, we have Diana Steakly-Freeman, who is a web developer and systems and web developer of CyberGuide, which is a nonprofit organization that is devoted to, what was it? Sorry about that.
So I work for CyberGuide. We're a nonprofit organization out of Northwestern University and University of California, Irvine, and we review mental health apps available on the market for their credibility, their user experience, and the transparency of their privacy practices.
And you also work for Northwestern, right?
I do. So I operate out of Northwestern, but our team is split between a couple places. So I'm also part of Northwestern Preventive Medicine.
Okay, awesome. So one thing I want to note about my own work is that it's very much an academic project, but it's also a personal project that is deeply informed and inextricably tied to my own diagnosis with schizophrenia. So, but I do want to just jump into this topic right away because we have a lot to talk about. And the first thing I want to do is direct the first question to you, Tom, which is, what are we talking about when we're talking about digital mental health? What exactly are the technologies that I guess, from a professional perspective, like that kind of fall under the purview of this term?
Well, it's thanks, Anna, and thanks for including me. This is really a delight to be part of this. The digital mental health is becoming kind of the hot topic of the day, and it's probably best thought about in three different areas. At least that's the way I think about it, just to keep it simple. One is that it's using digital tools, whether those are smartphones or wearables, to measure. You heard a little bit about this in the previous panel. That we don't often get engaged until really late. We're talking about a crisis. Can we come up with a way using digital tools to identify much earlier when people are in difficulty? So it's not you're not getting there at stage 4. You're getting there much earlier. We're doing this really well now with diabetes. We're doing it really well with heart disease. Why aren't we doing it for schizophrenia, bipolar, depression, etc.? Second bucket is to use the same technology, mostly the smartphone or sometimes a computer, a laptop, to provide treatments. So it's not just having a smoke alarm for the measurement, but actually having an intervention to put out the fire. And those follow a whole range of different approaches, everything from online peer support, which has become, really has gone viral. It's a really popular way of people connecting with each other, creating community online, not only getting help, but giving help to others. Coaching, psychotherapy, a whole range of interventions that can be done online, because so much of what we need in this field is connection and is communication and understanding and sometimes skill building and learning. And the third area is using technology to sort of help the offline piece of practice. So it's everything from collecting data in a clinic setting to finding ways to integrate primary care and specialty care and a whole range of sort of tools for the practice of healthcare. And so those three buckets have sort of different pieces to them, different players in them. There are different regulatory processes and different financing issues. But I think that's a good place to start, just to kind of orient you to what we're talking about when we talk about digital mental health.
Mona, do you have anything to add to that in your work?
Is this on? Can you guys hear me? Okay, great. No, I think he did a really good job of covering that. There are, three large buckets. Maybe the only thing I would add, or maybe it falls into one of the three, is that digital tools they're really just that, just tools. So the current state of digital health, and we'll get into it on this panel, but falls very short of offering actual treatment and being, extremely helpful in that kind of traditional healthcare way. But they are tools that can be used to just digitize things that whether they're behaviors or checklists. As he mentioned, connecting with other people, anything along those lines. Is just digitizing things you're probably already doing, but just organizing them, and that's not being regulated, that won't be regulated, but that's just another, I think that falls under the digital health umbrella.
Okay, Diana, I'll turn that to you and see if you have anything to add.
Is that working? Yeah. So I really like the way Tom describes this in sort of three buckets. I tend to approach it a slightly different way, which is, and often in the clinical space, we talk in terms of spectrum rather than category. Actually, in some diagnostic, we do talk about categories. But for the purpose of this, I like to talk about this on a spectrum. And so just like the presence of symptoms can appear on a spectrum. You've got people on one end who may be experiencing things that they don't recognize as symptoms or don't consider symptoms. And then on the other far end, you've got people who are experiencing symptoms in an acute, critical way that requires them to seek intervention or treatment. And then you've got this whole middle ground of experiences that fall somewhere between. So I think a lot of the people in this room, as we're talking about working and living with mental health and mental illnesses, we're talking about the people who fall in that middle category. And one of the things I like about what Mona just said is describing them as tools, right? And so there's a huge space of people working both on the far on this end on trying to work on detection and intervention, and then there's people working to create digital actual interventions that can be used to reduce symptoms in a clinically meaningful way. But there's also this huge set and growing set of tools that are really designed to replicate the processes and insights that you have gathered by working with your clinicians or providers and figuring out a way to make those accessible to you in a moment of particular need or struggle. And so the only, I guess, thing I would add is that there's perhaps a little bit more nuance to categories. It's really useful to talk about it as categories for the purpose of simplicity, but there's also some very interesting nuanced things between those categories that hopefully we'll get into a little bit more, but that's what I would add.
So one thing I've kind of noticed when I've been looking into this topic is like it almost seems like there's almost a paradox for digital mental health, because on the one hand it seems really familiar to me, but on the other hand it's completely new, and I'm wondering if you could kind of give us an idea of like where we are today, like in this, like, and where we might be like in 10 years from now, but like what stage are we in, like when we talk about like digital mental health? I'm just curious if you have, maybe Tom can speak to that.
Well, this is a good one for Diana as well, but I'll jump in. My perspective on this is it's a 5-act play, and we're still in the first act. I mean, a lot of what we're talking about is based on having a smartphone, and smartphones are a little more than a decade old, or it's just really recent, and we're still figuring this out. And the technology itself is changing so rapidly that it's a little difficult to keep up. So these are early days. If you look at the literature for, we call it digital phenotyping, using this first bucket of using a smartphone or a wearable for understanding when someone's going to relapse, or even predicting recovery, any of those kinds of issues. There's a pretty robust literature that describes this as a great opportunity. It's actually a very limited literature that provides real data about the utility of this in a clinical environment. Diana may disagree. I'd love to hear her perspective on this, but it's early days. We just don't have a lot of science showing what is the value of this in a clinical environment. It makes a lot of sense, but we need I think Act 2 will give us a lot more information about what actually is going to be useful, who it will be useful for, when it's going to be useful, all of that. So I would sort of come into this saying this is exciting, there's a huge opportunity still to be proven out.
Well, let me say first, I don't disagree. I think that the science is very much still out on a lot of this. The one thing I would want to add, though, is that I think when we talk about, like, okay, so what is the state of the field right now? And my answer to that would be it's all over the place, but not necessarily in a bad way. And so what I think this digital phenotyping area is a really interesting one that Tom is talking about. And really what we mean when we talk about digital phenotyping is we mean figuring out a way to use your internet activity, your phone use, your sleep habits, who you communicate with online, what you shop for, a variety of these kind of digital footprints that we leave behind to identify whether or not you might be at risk of some kind of anything, a symptom or a crisis of some kind. There are some really obvious problems with doing that, right? And we've seen over the last couple of years what this kind of conglomeration of data can do and can show us when kind of left to its own devices. But I do think it's true that we are, the science is very much still out, but there's reason to believe that using a tool that's accessible to you can be helpful. Now, okay. It's one thing to say that suppose there's a variety of meditation apps on the market. Sound familiar? We hear about these all the time, right? And it's one thing to say using this meditation app over and over will create, we have no reason to believe that using it will create a sustained, lasting reduction in the clinical presentation of symptoms over time. Does that mean it's useless? I would argue no. Now, so I think it's really important to talk about the different disciplines that are operating within this space. And so there's the academic discipline and the clinical side, which we absolutely need, which is, do we have reason to believe that using this particular strategy on your phone is going to create meaningful, lasting change or a reduction in symptoms? But there's also a consumer side of, I have my phone with me all the time. I am currently experiencing a bout of symptoms of some kind, whatever that is for you. Does that mean, I would argue that the ability to have a coping skill that you know is familiar to you, so like for me, if I know mindfulness is useful and I am experiencing something and have a mindfulness app on my phone, that's a useful thing for me to have. And that doesn't necessarily mean that I'm relying on that tool for a sustained clinical reduction in symptoms, but there is a really gray area here between the clinical I don't mean to use academic terms here, but there's a clinical reduction in symptoms versus an ability to manage the moment. And I think a lot of what we're talking about in this room when we talk about working and living with mental illness, we're talking about people who, we all have done the work to identify the kinds of things that work for us, the kinds of things that don't. We heard a lot about this on the last panel, and we can use that insight to determine what tools we might be able to use. Now, there are people like Tom and others, and I think, Mona, you do some of this work too, in identifying in a computational and mathematical way what intervention is going to be useful for what person at any given time. That's a really difficult computational problem to solve. It would be great if we can get there, but again, we're in Act 1 of a 5-act play. But by nature of having experiences on, or having some knowledge of or insight of what works for you, that gives you a tool set that we don't need to automate with a computer, but you can make those decisions and keep something on your phone that can be kind of a digital toolkit in a pinch. So separating the academic and intervention side from the user experience, I think, is a dicey thing to do, but sometimes important when we're talking about the ability to improve functioning on a day-to-day basis.
So I want to ask, you mentioned that it's a lot different, like with technologies that are designed to, I guess, maybe more diagnose and intervene more, I guess, more invasively. Like, it's an exciting time, but nothing is really proven yet. So why is there value in pursuing this?
Well, I wouldn't say nothing's proven. So there is a place where digital health has already had a huge impact. There are actually two places where this has been adopted very broadly, especially in the US. One is in the electronic medical record, and the other is for billing systems. And I would argue that they both made healthcare much worse, right? So that should be a wake-up call to us. Just automating and creating something digital doesn't necessarily improve what we all hope will happen, which is getting better care for more people in a way that changes what we heard about in the first session. Takes us to really a vision that Beth spelled out of a better world with social justice. We're not doing that with the electronic health record. I think everyone would agree to that. So the question is, how do we get this? How do we take the pieces that ought to be usable for improving care and make it happen? There's a lot of work going on, and a lot of it is in the private sector, some's in the academic sector. And I wouldn't say it's not going to happen. It's just it takes time to get this really clear. Part of what makes this harder for mental health than for endocrinology or cardiology is we don't have the kind of what people in this field call ground truth. What you're always trying to do is train up these digital signals to something that you know is quantifiable and solid, and so you create a more simpler version of blood glucose, something that you can measure continually instead of having to draw blood, something like that. We don't actually have a blood glucose here. The best we can do is to try to get some sort of clinical ratings, but we know those are actually not that helpful often, and they're very episodic, and they may not be good predictors of things that we really care about, functional outcomes, when somebody's going to have a relapse, when somebody's going to require some kind of intervention so they can stay on the job, whatever it happens to be. So part of what I think keeps us from making the progress we'd like is that doing this kind of research is actually surprisingly difficult. We have a ton of data that we're able to collect, for instance, on someone's phone every day or on a wearable, but what we tag that data to is not as clear and often not as quantifiable. So that's a challenge just for machine learning.
Yeah, and if I could just jump in as a comment around the business models too, because what Tom's talking about is very important, the research, the academic research that needs to go in to validate all of these measures. But on the business side, you see, as Tom mentioned earlier, this digital health space is really popular. And you see a lot of these tech people coming together, building companies, and they're like, let's build an app, we see a need, let's build this. But they have really no expertise. They might have one medical doctor on the board or as an advisor, but they're not really bringing that expertise to the table. They're not building a product that's actually going to be useful. And then they'll take it to tech investors. I don't know if any of you are following the Theranos. All of the stuff that's going on, but I feel like it's a little bit like that, where tech people coming, they found a company, they'll take it to a tech investor. You're raising a low, seed or A round where you're getting maybe 10, 15 million. That's not enough to have these clinical trials and validate this research, and they don't even understand that. So they'll, at USC, the Center for Body Computing, where I work, they'll come to us and they'll be like, can you validate this app for us, or this device, and they have no money to partner with us to run this study, and they don't even understand that. So I feel like that's a huge problem. But hopefully some scientists and they'll start partnering with academic institutions more regularly, and we can start seeing that scientifically valid side of it being built up. But I think that's also one of the issues.
Okay, so I'm going to ask kind of a challenging question now, because we're talking about academics and scientists, and them developing these solutions. And so who is this benefiting? I mean, to what extent are the people who actually are these technologies are going to serve? To what extent are they being asked to, provide feedback or like co-create these solutions? Or to what extent are their desires and interests being implemented? I mean, we know that there is obviously a biological component, but surely people are not reduced to their, an objective measure. I mean, people are not bytes. Like one-size-fits-all solution's not going to be.
So something that I think is worth some kind of driving home here is that there is a huge divide in communication across this discipline. So the people who are working in this space can be loosely divided into three categories: academics, people with lived experience, and the technology sector. And that divide is as black and white as I laid it out just now, that there is very little collaboration across disciplines. So for instance, there are apps currently on the market, some of which we've reviewed at CyberGuide, that were built for and by people with lived experiences. There are also, some of those apps are rate highly on the CyberGuide measures that we administer when we review these apps, and some of them don't. There are a variety of reasons for that. We also look at transparency of privacy practices, and some people with lived experiences may be really ready to create this app, but may not fully understand the sort of data implications or what it means to use local storage on a phone or remote storage or any of those things. We've got a similar problem in academics, right? Where we've got academic folks who have a manualized treatment that we know works. Meditation is a great example. We know meditation works in clinical settings. There's a different question to be asked around whether using this particular app, whatever it is, to meditate multiple times, do we have a reason to believe that that is the exact same as doing meditation in real life? The science is still out on that. But I think this divide that you're talking about, this sort of difference between the lived experience and the apps and what communication is happening across those lines. And the truth is that while there are people making solid efforts to combine those voices, so one example is out of the University of Queensland. There's a group that reviews mental health apps on the MARS scale, the mobile app rating scale. Some of you might have heard of this or not. But part of that scale involves getting ratings from both credentialed experts in that area and people with lived experiences. So I don't want to, people are aware of this problem, and I don't want to make it sound like people are all kind of oblivious in their own little circles. We realize that this is an issue, but the lack of communication, especially between users in the tech industry in particular, is lacking. And things can happen. I can't drive home the point enough that the last few years have shown us what happens when technology moves faster than the public's understanding of it. And this is something that we will have to keep in mind, especially when we start talking about health tech. But we know that tech can run wild if we give it a chance, and we have to talk to each other in order to build tech solutions that work here. And I would posit that we are not doing a good enough job there.
Can I just add to that? Because I agree mostly with what Diana is saying. I think there is this interesting culture, which I didn't know that much about until jumping into the software industry in Silicon Valley. And the way that people make software is really different than the way they make most other products. It's entirely user-driven. That's the only way you make anything that anybody will use. In software design, we don't think so much about efficacy. We think entirely about engagement. What do people want? What will they use? And the only way you answer those questions is to ask them, not after you build it, but as you're building it. We call it user-centered design. And there's not a company in the Valley that doesn't do that, or if they do, they'll never survive, because no one can figure this out on their own. You have to sit down with people and get tons of feedback and constantly iterate whatever product you're developing based on the feedback you get. So it is quite different, certainly, than the way we would do things in an academic environment where there is a really clear divide. But I mean, just as an example, a company like ours on day one established an advisory group of people, many of whom you would know, with lived experience, who could come in and kick the tires on everything we were building, including the whole concept of what we were building. So I do think there's lots of terrible things that are happening in the tech industry, but this isn't one of them. This is the one place where I think most companies have brought in what they would call their customers, their users, from the very first day.
are you speaking of like Silicon Valley companies in general or digital mental health? Because, and one thing I want to make clear too is that not every person wants to give their lived experience. I mean, like honestly, I don't know if I'd really want to like, your products seem really complicated and not everybody like wants to understand and give their input, but it just seems like there's just an oversight of even like, like actively seeking out people who these technologies are going to benefit. Even if they say no, just the act of like going forward and talking to them and seeing what they want.
Yeah, I could see how you might imagine that. That hasn't been my experience. I think both working in a company like Verily, which was a spinoff from Google, and in Mindstrong, which is a small startup, but also I work with lots of other companies, some of which are actually led by people with lived experience. There's the whole thing is driven by trying to build a tool that people will use. If they don't use it, and as we often say, it's not enough to like it, you have to love it. It has to solve a problem for you. It has to be something that you can't live without, which is the real problem. We'll get to this, but as one of the real problems is that some of these companies have been so successful, not so much within health tech, but in other aspects of technology, that we're now all addicted to our phones and to a handful of apps that we use constantly and that probably know more about us than we know about ourselves. I'm not saying that's a good thing, but the way we got there was people realizing that you had to use this user-centered design. You had to co-develop products with the people who were going to be your users, and if you didn't do that, they would never fall in love with them.
Now, if I could add, so I don't mean to, I think we're going to end up going back and forth. And no, I agree with everything you just said. And I also want to be careful about where I say there is a divide. And I think your point is a really good one, which is that the tech industry in particular is all about users. Where I think there's a particular divide is, first of all, data management, and I'm a data person, so like so I think there's a tech divide in what we mean when we talk about data, what we mean when we talk about user data. But I think in particular, where some companies have fallen short of this sort of cross-disciplinary communication is not so much between the tech and the users, but the tech, the users, and the people who are trained in how to address the problems that the users are facing. And so I think it's one thing to create, which is not to say that apps don't do this. I think there are a lot of companies that have done great work to try to get users and academics and people who are trained in intervention all in one room to try to put apps together. And those apps are on the market, and those apps are great. But I think there's something, it's really easy to create an app, and I think sometimes we may underestimate just how many garbage apps are on the market. And so it's absolutely true that there are people in this space doing great collaborative work, and I do not mean to undermine that in any way. But for the most part, on the whole, these apps are not, there are exceptions that are really well collaborated and thought through and deliberative in how the interventions are delivered. Launching an app can take 10 minutes, and people have done it when they're 10 and 12 years old, which is great. It's great for innovation, but I think there's a general, for the most part, there are thousands of mental health apps, and the vast majority of those were not created in any coordination with an academic or a trained clinician or clinical provider of any kind. And I'm talking just about mental health apps. That's separate from all the other apps that we're all addicted to and that are really great. But I think, I realize we're all sort of implicitly talking about Facebook a little bit here, so I'm just going to name it. But one great example is these major tech companies maybe took on a little more than they realized, and we face something kind of similar here, that it's great to create a great product, but I think there's a specific lack of communication between the people who can make really solid evidence-based decisions about when tech is useful and when it's not, and the industry who's designing a product. And the goals are different, and I think we need to pay attention to that the goals are not the same. The goal of creating a product may not be the same as the goal of minimizing symptoms. For instance, if an intervention was really effective, theoretically, you might no longer need to use it. Is that really the goal of the tech industry, to create a product that you would use for a while and then eventually stop? No, and that's the creation of an app like that is designed to be an intervention would have to be, by its very design, a collaboration between people who are not interested in creating a tech product per se. how do you facilitate that kind of ongoing collaboration between people with very different goals, but one shared goal of minimizing the experience of mental health symptoms or crippling symptoms? I don't have a solution for that, but I think the vast majority of apps don't have that kind of collaboration, but there are projects like Mindstrong and others that absolutely make solid efforts to do that. Unfortunately, it seems to be the bigger companies, the most successful companies are the companies that build products first and interventions later. And I think that's where we introduce problems.
Yeah, and I just wanted to, I completely agree, perfect. I love the way you said it. And just, well, part of the reason that this is happening too, and I don't know if we're getting to it now, but I'm going there, is that the FDA isn't regulating this space, and not just for mental health, but just for digital health. They're not deeply regulating it unless the app that you have is for a high need patient, or it's going to be directly involved in a decision making for a physician in treatment for a patient. So, but for the most part, the FDA has taken a hands-off approach to regulating any digital health, including mental health. So if you have these companies that have, they're just starting out, they're building this, they could even have a wonderful medical advisory team or a medical team. They don't have to, right? If you have a biotech company or a pharma company, I mean, you're going to face the FDA. From the beginning, by design, your company has raised money to address those issues. You don't have that same, threshold to reach in a tech company. And
Mona's right. I mean, the FDA is trying to do this. The best they've figured out, because they realize since the product, unlike a drug, here with software, the product's changing every 3 days. So how do you pin that down? How do you regulate that? With a drug, you freeze the drug as one chemical structure. You don't change it ever. That's sort of the foundation for the regulatory science. So this is a very different animal. And what the FDA has tried to do is to say, well, maybe we could regulate the process. Maybe we could sort of certify that certain companies are following good processes for developing software. And that's working a little bit, but it's not really getting at this issue. The most interesting opportunity to do this, I think, is this thing that Diana's building, which is really fascinating. It's saying, look, let's not wait for the government to do it. Let's get together as a group and figure out, what do we want? What does good software look like? What does a good mental health product look like? What do people need? What do they want? What kind of privacy protections need to be in place? What sort of levels of evidence should people be able to understand? Think about like consumer reports, before you buy a car, when you go out and you get that information about how does this work? People need to have access to that, and especially in a space like this where there are thousands, actually now tens of thousands of products, and no way to navigate that. And the FDA is not going to be able to do that, I don't think. So I think the idea of CyberGuide doing it is pretty exciting.
There's a slight way to navigate it. We tried to make one.
So I want to go into ethics now, because this naturally brings us into a conversation about ethics. And I want to start with Mona, because you were part of, I think, Stanford University recently released, I think, 10 principles that were guiding digital mental health ethics, which is really nice to see. And I'm really happy to see you on that. However, once again, it's all full of academics and industry people. So again, I ask, where are the people who actually have, who don't have that background and have consumers and people with lived experience? But that aside, I think that the ethics issue is obviously important, but I think that how we define, prioritize our ethics issues are also, and I know that privacy is very much an issue, but I'm not convinced that people who, like the users of these apps are necessarily, that's their priority. And I'm just guessing too, and I'm also doing a study on this to measure that among consumers, but I feel like a lot of times data protection and privacy tend to be overemphasized, whereas autonomy tends to be not emphasized at all. And I mean, privacy is important to me, but I still use Facebook. I mean, if I really cared about my privacy, I would have deleted my account. So I'm just—
It's not too late. You could still
I know.
do it.
So can we speak about ethics a bit? And
Hey, before we do that, can I just butt in? And I'm sorry to do this, but the way you frame the question, I just want to make one thing clear, and that is, I wouldn't assume that there aren't people with lived experience who even view themselves as consumers who are in this within either the private sector, the academic sector, or any place else. One of the things that I have come to learn through my years in government and now even in Silicon Valley, almost everyone's a consumer.
Right, but they're not open about it. Being open about it.
They're not open about it, and that's part of it. But I can just tell you, like in my company, the people who come to work for us from other places, other companies, they don't come there because we pay better. They don't come there because we have better snacks. It's all about the mission, and they care about the mission because they've lived it, and it's so. I think it's kind of important to realize that they're not everybody who isn't out there as an advocate is ignorant of what the experience is of being hospitalized or being or even on a 5150. I mean, many of the people in my company have really been through it, and they're there because they want to create something for other people, so they don't have to go through what they've been through. So I just want to, I think it's important to not make an assumption that the world will be divided into those who are consumers and those who aren't.
Well, I agree with that. And to be clear, my assumption is based on the list of people and the fact that they show their titles next to it. So these people are not identifying themselves as consumers. They're identifying themselves as people with credentials and expertise. So I feel like that's what I'm sort of responding to.
Okay. So to your question about autonomy.
Well, so something that I kind of want to jump in. So for those of you who don't know, I'm going to do a quick shameless plug. CyberGuide is a mental health app guide. So what we do is we review apps on the market with the goal of providing users with the information they need to make informed choices. And so I think this kind of gets at the idea of autonomy, right? It's absolutely, we should not wait for the FDA to figure out how to regulate this in order for us to be able to move forward and use tools that might be helpful to us, right? And so I think there's truly a sort of frustrating degree of autonomy on the user to try to figure out what works for them. Something that I think mental health, I don't know if we're going to use consumers, anybody in this room, myself included, consumers, parents, anyone, I think educating yourself on what matters globally to the field and then zooming in on what matters to you can be a really effective strategy for determining where you're willing to go in this space. So for instance, if you take medications and you struggle with using maintaining your regular schedule, there are apps that can help remind you to take your meds. Now, that involves entering what app meds you take into an app. For the most part, that information is gonna, I can't vouch for the privacy practices of every app, but if you're not logging in, you can make some decisions about where you're willing to exercise a little bit of your own, caution. If you're still on Facebook, you probably won't mind, entering your birthday into an app. What we're trying to do at CyberGuide is give you as much information as you can about what an app claims to be doing with your data, where the app got its funding, whether or not there's been any research on the app, how frequently it's been updated, how specific the proposed intervention is. And it's true, people need more autonomy. We need to be able, and we can't rely on the government or the FDA or the NIMH to tell us which apps we can use. And the truth is there is a lot of information out there, but our goal is to, given that there's so many apps and so many different ways to think about it, CyberGuide's goal is to provide people with the autonomy to make the decisions for themselves or in coordination with a care provider on what apps will be most effective for you to try and make some judgment calls based on your own insights, your family members' insights, your clinicians' insights, and things like that. But I think the issue of autonomy is an important one, and I think it's also important to point out that nobody is suggesting the replacement of clinical providers for apps. That's not the argument. And I would agree with what Tom said, that everybody who's working in this space we are all doing the best we can with the guidelines that have been in place thus far, which are limited. And so I don't think there are any serious app developers who are creating products in this space with the intention of slighting mental health consumers. It's not that. I think if anything, there is sometimes a sense of privilege that goes into developing an app, right? A lot of apps are designed without paying particular attention to the stigma associated with certain types of symptoms, right? Especially when the case of like social connection apps and community networks online. But I think the goal is that there is a lot of autonomy and onus on a user to make some decisions. Arguably, some of those decisions should be made by other people, other federal authorities, other regulatory bodies. But in the meantime, there are places that you can get the information you need to make informed decisions.
Can you just briefly tell everyone what CyberGuide is? I mean, just like tell them it's like a website, because it's a really great resource if you're new to this topic. And the topic is so, like, there's just so many apps. And this is a great resource for people who like actually want to learn more. It's a good place to start.
Happy to. So CyberGuide is, so like I mentioned, CyberGuide is a nonprofit. We started, we're a project of OneMind, formerly OneMind Institute for Brain Health. But so now we operate out of Northwestern and UCI, and our primary goal is to deliver consumers information. We do some other research as well, but our primary product, so to speak, is reviewing mental health apps on the market. We try to get the most talked about apps and make sure we really talk about apps that have been kind of circulating in the public space. So things like, we did a lot of work with Headspace and Calm, because those apps were like topping the charts in the iTunes store for several months at a time. We've also done some work with the Department of DHA Connected Health, which is part of the Department of Defense, has created a suite of apps for things, symptoms related to PTSD and combat. So we review those apps, but we are pretty wide-reaching in the types of apps we review, and what you will find if you go to our app guide, which has recently been rebooted and easier to use, and you can use it on your phone now and a variety of other things. But what you'll see is that there are a lot of apps that score really poorly. In particular, we've been focusing a lot on reviewing the privacy practices and the privacy policies of different apps. We're not evaluating the practices themselves. We are evaluating the transparency and clarity with which they explain what they do with data. And so that's specifically what we're looking at. And there are a lot of different things that we should continue to look at and grow. But largely speaking, what you can do is you can look for a specific treatment type or a specific condition and browse the apps that are available on the market to our knowledge, and how we've kind of scored and evaluated those based on the evidence that's out there. So,
no, and I think what CyberGuide is doing is really important, and in some ways, digital mental health is ahead of just regular digital health because of that, because there aren't other organizations like, and we always talk about this at our center, just because an app is scored well in the App Store, it doesn't, if it's a digital health app, that doesn't mean anything. It doesn't mean it's effective. It doesn't mean it'll work for you in particular. It doesn't mean anything, right? It just means it's popular. So it's really important, and you're right, we can't, even if the FDA decided to regulate digital health apps, you're not gonna get as much information as you're getting from CyberGuide, right? About privacy practices and what's happening with the data and all that. So these kinds of independent, I guess, bodies, nonprofit orgs, we need more of that.
The way we usually think about this general topic, which is, you could say this is really about the public trust question, or maybe the ethical question, although I think public trust is a broader frame than just pure ethics, is there's sort of three pieces to it that we focus on a lot. One is the transparency, which just heard about, which is what's collected, how is it collected, where is it stored, when is it collected, why is it collected, all of that. A second piece is around this agency. Like, do I have the ability to quit, and do I own the data? Does someone else own the data? Can I erase this at some point when I don't want my employer to know about it, or whatever it might be? And the third piece is really around the broader question of how is privacy managed, and is there a responsible use of information? And is the privacy protection something that I can understand not just today, but going forward? What happens if, for instance, if it's a private sector company that I'm engaged with, what happens when they get bought or when they go belly up? And there's just a whole bunch of issues. CyberGuide deals with some of these, but increasingly what we're trying to push for is that everyone in this space, including consumers, know that these are questions that have to be asked and answered, and that the information about each product is out there, just like it would be if you were looking at efficacy and safety of a drug, or the safety of an automobile or anything else.
Also, as this is a legal, question.
All right, let's get a question. And I'm going to ask that people be very direct with their questions so we can get through a lot of them. Hi.
Hello, my name is Rudy Caceres. This question is for Dr. Insel. Sorry if it sounds like a weird question, but do you think that, say, in the next 100 years, we'll get to a point where our brains are more artificial intelligence than biological intelligence, to the point where the artificial intelligence will basically be able to delete depressive thoughts or panic attacks or voices that are terrifying?
Wow. That sounds like a yes or no question. And I don't know. There's this explosion of AI, much of which I think is hyped. I think we'll have to see. Actually, this is Mona's deeper into this than I am, I suspect. But there really are questions still about how far this will take us. No doubt that when it comes to creating machines that can identify patterns, whether that's pictures of cats or figures on a chessboard, AI is just really good at that, and probably better than humans. But whether AI will do the kinds of things you're talking about, I don't know. I think we're still at this kind of hype stage. There'll be some stage when we think it's really useless, and in about 5 to 10 years, we'll figure out what really is going to be helpful here. Mona may have a better idea about this.
No, I agree. I'm so tired of talking about AI, but everybody wants. It's like, as Tom, it's very good at what it does. I think I think the potential is there for it to be amazing, but I think as it exponentially grows, I think a lot of, are humans going to let it just unbound and run free in society? Probably not. We're going to be having these discussions about ethics and privacy because it could take over our minds. Who knows? But I also think AI needs to be deeply regulated. I'm not really big on regulation, but I think in this instance, I just think it's overhyped. I think a lot of the companies want it to be overhyped and kind of kept in the dark, just because it's easier to raise money, it's easier to get people excited. But is the technology there, and do we want it to be there? Those are questions. I don't know. We haven't answered those.
Hi, next question.
Hi, my name is Jenny Farrell. I'm the Executive Director for Mental Health Advocacy Services here in LA. We do a lot of work with youth and special ed work, and we see from a lot of our community partners them telling us kids are on their phone all the time and they haven't developed the social skills, and it's contributed to anxiety. And I have 2 young kids, so I have 2 questions. One is, should we just be throwing our phones in lakes instead of using them as tools? What do you think about that? Do you pay attention to that? I'm sure you do pay attention to that debate, but I haven't really seen a lot of great data. I've seen one report that has thought that maybe the increase of suicide amongst young people has some correlation to tech use. So I'm curious for your thoughts on that. And then my second question is, I'm not a tech person, but I understand that you can develop technologies in ways that make it more addicting. You get the push notifications. There's a new meditation out today. You must click on it. So do you develop your technologies in ways that don't lead to that addicting behavior? Thank you.
Anybody can take that.
So I'll start on this one, mostly just to say that, first of all, that first idea sounds great. There you are. The first idea of throwing your phone in a lake sounds great. I don't know that if we could do that on a wide scale, maybe we should. I suspect that most people would protest. In which case, I as more directly to your question about the sort of addictive nature, I actually sort of slightly disagree around the AI point. I think that AI right now is targeted specifically at grabbing our attention. That's what AI is designed to do. It's designed to figure out where we're going to click and get us to keep clicking. We do not use ads or clickbait or anything like that in CyberGuide, and I think more specifically, we should be really careful about ads in particular and how ads are used in AI on free apps and things like that I would argue that the addictive element, what we're talking about, is the satisfaction of hitting a notification, and that is specific. That is the whole foundation of most of Silicon Valley tech, is trying to figure out how to capture, predict, and monetize our ability to focus our attention on our phone. I think that hopefully regulation of AI and things like that, and things like ad choices and breaking up some of the major advertising companies that do that, is a step, but. Yes, we build technologies to try to avoid that. It's a very difficult problem that is fundamentally rooted in how this industry has decided to grow.
Yeah, I completely agree that this is, this horse has left the barn. There's no kind of, as much as all of us may have wished that the horse had never been born, we're living with this amazing technology that is global. 3 billion smartphones. I was last year in Tanzania in a very remote area, and every Maasai warrior had a spear, 3 goats, and a smartphone. That's the world we're in now. It's not a world like we've ever seen before. I agree with the question that that raises lots of concerns, especially for young people who are digital natives and have grown up with this. This is what they know. Now, the data are still not entirely clear. There are data from San Diego State, from Jean Twenge and her colleagues, showing pretty amazing correlations between the amount of screen time and a loss of sense of well-being in teenagers. And that has increased quite significantly. And if you look, by the way, at trends in mental health diagnostics with epidemiology study, the only thing that's really impressive in the last decade is the increase in depression and anxiety amongst adolescents. No other part of the population has shown really much of a trend in terms of prevalence changes. So, that raises this question about what's driving that. How much of it is technology? So far, most of this is correlational. It's not an easy experiment to do because you can't get kids off of phones. I work with a private hospital in the Bay Area, and everybody's phone is taken away when they're hospitalized for 5 days or 7 days. And for adolescents, the biggest driver for them to get out of the hospital is to get their phone back. They really care about this. So
I just want to make one quick point as someone, if you want to see your social network collapse in like 10 minutes, it really does it when you're going through psychosis or when you're experiencing something that like a really serious mental illness. And so I don't want to throw my phone in a lake. I mean, I think that there is merit to these arguments, but also the ability for technology to actually allow people to connect. I mean, I prefer to stay home. I don't do a lot of in real life engaging. I mean, I do, but I speak to my best friends every day and through email and text, and that stuff is very, very important to me. So.
Yeah, that's great. I mean, I think this is such an important point to make, and we don't make it enough. Because it's pretty easy to bash the technology, and I have to confess, even though I'm in this world, I tend to do too much of that. But there is a way in which loneliness is a profound issue in our culture, and for some people, not for everybody, but for some people, this is part of the solution. And I think we want to be mindful of that. It comes with risks. All technologies come with risks. The question is there a way to manage the risks and get the benefits we want?
Okay, let's move on to another question. How about you?
I actually have a feeling my question will continue the conversation. When I was a teenager, we wanted to get out of the hospital for cigarettes, so things haven't really changed much. So I'm Leisha Ostrow, and I am an academic researcher and a person with lived experience, and also now getting into the space of making internet-based tools, which I feel some ambivalence about for the reasons that have been mentioned. Although I have also read some studies that are specifically on people labeled with serious mental illness that show that using social media actually increases their well-being and sense of connection. So I think we always have to be looking at different strata and subpopulations when we're making general comments about those kinds of things. I'm actually in LA this weekend because I was speaking at a conference at UCLA yesterday on social entrepreneurship. Which was strikingly different than this in some ways, including that there were a lot of people there running various different types of businesses in different sectors, and often from a place of lived experience, and much like providers, there were some, there was a gentleman whose white and used to work on Wall Street and now is starting healthy food businesses in South LA and neighborhoods of color, but had come to that business through, his experience of his own white privilege. So, but then there were people like me who started their businesses because, I'm a psychiatric survivor and I wanted to help other people avoid what I've been through. I wonder about like developing internet tools and sort of making people be further, wanting people to connect, but not wanting to subject them to more feelings of isolation or addiction to the computer. And I guess my question is like, how do we marry the ideas of social entrepreneurship and social enterprise? And by social enterprise, because I know there's a Clubhouse session after this, I mean businesses that focus both on making a profit but also doing good and those things at the same time. How do we marry social entrepreneurship with what's happening in tech and I guess what's happening with capitalism more broadly, right? What's really what we're talking about is how do we keep putting profits ahead of people and expecting the world to be a better place? So what do we do about that? What do I do about that?
So I just want to start by saying that the tech industry in particular is not made of bad people, and we want to be really careful. It's super easy, and like Tom, I fall into this trap too. If it's really easy to bash tech, but it is important that we talk about the need and space for innovation and where the line is between innovation and introducing harm to consumers. And I don't have a solid answer for that, and I don't know that we have one. But I think it's important that when we talk about like increased cell phone use associated with negative outcomes, it's absolutely true, and that could mean any number of things. And so this is also true when we talk about privacy, that are there cases where things have kind of gone haywire? Yes. But I think it's important that we not discredit a whole category of tools that can be useful by nature of the platform on which they exist. And so I think, to your point about creating innovation and allowing space for innovation and letting businesses do, it's a difficult question of where does innovation become dangerous, and in this space we see a lot of that. But I do just want to drive home the point that your point is really well taken, and we need that, and we want to be careful to not demonize an entire category of a platform because of the problems they have caused, which are real, but some of those things are a little more nuanced than it sucks or it doesn't.
Okay, we've got time for 2 more questions. One question? I'm sorry, one question, but maybe you guys can ask afterwards. Sorry.
I just wanted to say any new product or innovation has a multitude of problems that have to be ironed out. You don't want to throw out the baby with the bathwater. It's important. But we live in a society that's so farmer-centric. And I see a lot of promise with technology. I don't know if you've heard of the new Alzheimer's study, where they were able to...
I'm going to interrupt just really quick. Can you frame the question just because
yes,
we're running out of time?
The question is I want to see how this can be I want to ask if you can see this being transposed to technology and to people having just through their cell phone, their smartphones. Because in this new study, they're finding that in Alzheimer's, just by delivering flashes of light and certain clicking sounds, they can actually improve cognition and wipe out amyloids in the brain. So
there's a lot of interest in thinking about whether sensory stimulation for autism, we've been talking about this for years, and hasn't really played out yet for mental illness per se, but it's a good question in the sense that this gets us away from looking for magic pills, which is what the field has been so consumed with. By that I mean the research community for the last 4 decades. We're now thinking that, gosh, maybe there isn't going to be a magic bullet in the form of a pill, and maybe there are other sorts of interventions that we ought to be thinking about. And combining that with ways of collecting information at the same time so that you could create a kind of learning loop the way we do for other things where the software both tells us if it's working, and then if it is or not, you titrate accordingly. your intervention. So I think there's a real opportunity there.
Yeah, and I just want to end on a positive note by saying we talked a lot. I spend all day thinking about the doom and gloom of technology and of digital health in particular, but I think it is really important to mention that there is a lot of potential there, and it's very exciting, and if it can be realized in a manner where we can prove it's safe and effective, and patients will be safe, then, I mean, that'll be wonderful.
Okay, I'm so sorry. We have to end because there's another panel, but maybe people can come up and talk to people otherwise. I'd like to thank the panelists here and thank everyone for coming. This was really fun.